At the VA, we understand that not every injury sustained in combat is visible. Sometimes, the wounds of war are suffered in silence. This was the case for Charleston veteran Paul Middleton Jr., who served in Vietnam aboard a Navy destroyer in the early 1970s. Some of the things he saw there changed and haunted him for years.
Some of the things that I experienced, they were this lying dormant within me until I had an accident on my job. And when I had that accident, that kind of threw me into a tailspin, and I found myself started having these horrific dreams to the point that I would really get some terrible thoughts concerning suicide, hurting others, just very agitated, didn't want to be around nobody. I mean, and this went on for quite some time.
When Middleton came to the Ralph H. Johnson VA Medical Center for help, Dr. Matthew Yoder, a clinical psychologist, introduced Middleton to a relatively new treatment called in-context exposure therapy.
Well, it's really important for combat veterans to face the fears or the anxieties that they have related to traumatic events, because the only way to get past the anxiety is through it, not to avoid it. So if a person has PTSD, by definition, they've tried to avoid and push this stuff away, and it hasn't worked. If it worked, they wouldn't need to come in. If it worked, we wouldn't have PTSD. To help veterans decrease the fear that they feel, or the arousal, the hyper-arousal that they feel in relation to certain triggers or situations, we approach those situations in a very slow, systematic way.
As part of the VA's in-context exposure therapy program in Charleston, psychologists take their veterans out in public to face their anxiety triggers. Sometimes it might be as simple as going to a busy marketplace to overcome uneasiness with crowds. In Middleton's case, the VA has an arrangement with Patriots Point Naval and Maritime Museum in Charleston to allow the psychologist to take patients for free to get up-close exposure therapy aboard the Navy ships on exhibit.
After seeing the benefits or the gains of approaching what one is afraid of instead of avoiding, that can be a lot of motivation to come back and keep doing the work.
Middleton is walking proof that in-context exposure therapy can make a difference.
This is where it's at. It has given me an opportunity to really kind of look at what really happened and get an understanding of what's going on with me. And so with this program, it's allowing me to really see what happened, how it happened, why it happened, and how to try to at least fix it to have the remainder of my life for myself. What is happening, we is reaching out and touching these things that was hidden for so many years and addressing them. And it really helps. It's helping to the point now that I can face my fears. I can actually face them. And it's not all the time that I win. But guess what? It's not all the time I lose.